Thank you, Dr. Dorman, for the introduction, and thank you everybody for attending. As Dr. Dorman said, my name is Kira Gouchie, and I will be discussing heat illness in wildland firefighters today. So just a little background on the fire prevalence in Canada right now. Wildfires in Canada right now are heavily being impacted by climate change. Climate change is producing more favorable conditions for the production of wildfires. And because of that, and because climate change is impacting that, wildfires in Canada right now are becoming more frequent and more severe. And what I mean by that in terms of severity, wildfires are covering a larger area and more frequent. They are lasting for longer periods of time. They are extending the fire season due to those conditions. And because the impact and the increase in wildland firefighters or wildland fires in Canada right now, there's an obvious impact on the well-being of not only us as we're seeing them on the news, but especially to those that are responsible for putting out those fires. And that is due obviously to the occupational and environmental stressors that are associated with that. And one of the main environmental stressors that is experienced is heat and how that impacts the body. And because of that, AFFES and MNRF are concerned about the incidences of heat illness and heat stroke within their wildland firefighters. So as I was discussing, this kind of graph highlights the severity and the frequency of fires in Canada by year. If we're looking at kind of the earlier years of this recorded graph, we can kind of see that the phenomena of wildfires, we're at a pretty low trend. There were a couple instances every several years where there would be a very bad wildfire, but for the most part, numbers were low. As we're continuing on, we're seeing a trend of more frequent and a more steady trend, obviously excluding the years 2019 and 2020 due to some interruptions in data collecting due to COVID-19. Just for an example, in 2021, there was almost 75,000 fires that were occurring in Canada that year, and is a substantial increase from the previous years. So that's kind of highlighting the increase in severity and frequency of the wildfires. So in a little background into who is putting out and responsible for these wildfires. Wildland firefighters in Ontario are employed by the Ministry of Natural Resources and Forestry, MNRF, in the Aviation, Forest Fire and Emergency Services Division, AFFES. The fire season of which these firefighters are employed typically can last anywhere from April to October. And again, that's subject to change based on the severity of the fire season as well. And there are up to 800 wildland firefighters that are employed across Ontario every year. That number can also fluctuate based on the severity and the amount of crews that are needed. And then, so within the employed wildland firefighters, there are different levels as to which these employees rank. So crews are typically deployed in groups of 4 into the wildland wildfires. The typical crew consists of a crew leader, which is also known as kind of the veteran or the cerebral behind the operation. They are the primary supervisor in command and responsible for not only the performance, the safety, and the welfare of the employees that they're supervising, but also maintaining the span of control. Next is the crew boss. This is also known as kind of the logistic coordinator or the right-hand person to the crew leader. If there's any tasks that need to be delegated from the crew leader, they will do that to the crew boss. This can range from constructing fire lines with chainsaws and various hand tools, or any other suppression activities or operations that are occurring. And then the last level is crew members. These are typically university or college students, and they do a brunt of the heavy lifting and heavy work when constructing the fire line and putting out the fire. Within these types of fire suppression activities, There are also different types of deployments that are occur. So the first one is the initial attack. So that's considered the first response to any detected fire. It includes a first on the ground fire assessment, which involves various physical and mental demand, especially when accessing fires in remote locations, since they are first on the scene and responsible for cutting down and clearing area and setting up all the equipment. These deployments are most stressful and most physically demanding and are short in duration because of that. So they last anywhere from 1 to 2 days. Next is project fire. This is when crews are deployed to fires that have been active for an extended period of time, and they continue the physical demands that were put on by the initial attack deployed wildland firefighters in order to continue to mitigate those strategies to put out the fire around the area. So that can last anywhere from 3 days to several weeks, depending on the severity. And we're seeing project fires lasting more and more as several weeks due to the severity of the fire. And the last type of deployment is just fire-based. So that's when the wildland firefighters are at base waiting to be instructed by headquarters to either complete various tasks, such as their daily fitness requirements. They have a pretty intense fitness regime in order to match the demands of the job, or other non-emergency tasks such as restocking, inventory, making sure everything is set for the next group that are being deployed out. So if we look here, it is evident that heat stress has always been a factor for wildland firefighters. That's what their job entails. They're dealing with fires. But as the severity of the fires and the frequency of the fires continues to increase, so does the heat stress that they are experiencing. And that's when they're experiencing elevated temperatures, and the body cannot control its internal temperature due to those surrounding temperatures. Again, highlighting wildland firefighters include vigorous work, have to wear extensive PPE due to the conditions that they are sometimes working in remote locations, and they experience high ambient temperatures. So all of these factors that they are experiencing increases their risk of several illnesses and health-related issues, one of it being obviously heat illness. And we can see the various stages of heat illness are recorded down below. Most of the time, especially in occupational settings, the events that are recorded are heat exhaustion or heat stroke. They're recorded when somebody is extremely hydrated, dizzy, collapse, or heat stroke when somebody either needs to be airlifted to the hospital or taken to get medical attention. Those are the ones that are the events that are recorded, but it's the stage 1 and stage 2 precursors that need to continue to be integrated in the recording of these heat illness events to prevent the long-term problems and long-term mental and physical health problems that come from heat exhaustion and heat stroke. Having just one of either heat exhaustion or heat stroke, any of those two events, can increase your risk of having more events in the future, and can also impact employment. If you are at risk of having heat stroke or heat exhaustion compared to your peers that haven't, that's obviously going to impact your employment, especially if wildland firefighting is your primary job or employment. So that's various stages of heat illness. So for most workplaces that are hot due to process heat, they are expected to follow the ACGIH guidelines. However, in a dynamic setting, such as MRNF and AFFES, it's difficult to implement those heat stress guidelines due to fluctuations in the weather, both over a day and then over a fire season. So accordingly, in order to provide some kind of guidelines and procedures in place, AFFES and MRNF developed the Heat-Related Illness Prevention Guide. This provides both workers, supervisors, and managers with the training requirements associated with the prevention guide, education on heat stress, heat strain, heat illness, and heat prevention, and then the responsibilities of both the employees and the workplace when heat illness events occur. Within this, the first part kind of highlights some of the various controls that are put in place. One of the first controls put in place are the engineering controls. So this includes vented helmets, reflective shields, cooling fans, and then canopies to provide some shaded work areas when working in direct sun. These controls are not always the easiest to implement due to factors such as where they're located or the feasibility of such controls. So to combat that, they also have the administrative controls in place. So that includes the climatization of workers. So just basically as those workers are subjected to working in heat, as long as they're healthy and have no pre-existing conditions that could impact their body's ability to work in heat, they will slowly begin their body as they are experiencing and continuously exposed to, their bodies will adjust accordingly and become more effective at dealing with heat in the workplace. There's also cardiovascular fitness. As I mentioned before, they have a pretty extensive fitness program that all the firefighters, while they're on fire base, are expected to partake in. And increased cardiovascular fitness can also translate to an increased ability to handle heat when exposed to that. So they promote that within their fitness program. And then they also provide consultation with healthcare professionals should they be worried about an employee or just want to get the clear to make sure that the employees will be adequately able to withstand the heat that they are subjected to. So that includes kind of consultation with a physician as well as a PAR-Q questionnaire. Another component of the heat illness guide is the hot weather plan. So that's one component of it, and the intent of this plan is to initiate precautionary measures for working in hot weather before workers begin to show signs of heat illness. So before workers begin to show whether it be heat cramps, heat exhaustion, or the heat stroke. This plan is put into effect when the humidex is forecasted or reaches 35 degrees Celsius or above. This is kind of broken into two main components. So first is monitoring weather. At the beginning of each day, there are weather briefings in the AM daily briefing that they have, all the employees gathered together. And in those weather briefings, they will provide a humidex report and indicate if there are any elevated or advisories about humidex or a high humidex to prepare the workers for the day. So they will have that and they will disclose that to the workers. AFFES has weather stations that are both permanent and portable, and those weather stations will also alert everywhere from the main headquarters to the surrounding regional headquarters of high humidex days or high temperature days that increase the risk of heat illness. And the portable weather stations are actually for people that are already on the line, some of the crew members or crew leaders. They'll send out an alert to those that can't really participate in the weather briefings. So they're aware of that as well and can implement the strategies. They also follow and will promote humidex heat advisories, kind of the same that we get, but on a bigger scale with from the satellite data that they collect at the weather stations. The other component is communication systems. So this involves a lot of first self-monitoring. So when the weather briefing, when they announce that there is an elevated risk of heat illness due to the temperature outside, they will promote all employees to do more self-monitoring, make sure they're checking in with themselves throughout the day to ensure that they are at their best and not at risk of heat illness. And they will also instruct them of who to talk to and what they can do if they are not feeling, and if they feel it, that one of those events might occur. There's also an increased promotion of observation amongst your peers. So if you're working and you notice somebody, especially this is relevant with the crew leaders that are in charge of the performance and welfare of the crew that is deployed, they'll encourage observation. So making sure you're checking in with everybody and making sure that they're okay. Now, given the changing nature of fires globally, there's a greater incidence of heat illness than previously reported. back, if we refer to the graph that I had shown earlier, in the early stages of the data collection, there is a less or a greater risk of heat illness due to the increased severity of the fires and the duration of both the fire season and the shifts that the firefighters are deployed in. And so because this increased risk, it requires a more rigorous prevention plan than the one that is currently in place to be adequately addressing the increased risk. So there are a couple challenges because of that. So AFFES's current approach right now does not account for individual differences. So age, sex, and height, health, for example. Somebody that's younger, just for an example, is going to be able to combat heat illness than somebody that's older. So it doesn't, the AFFES's current approach doesn't really account for that. Then the weather stations right now don't consider the ground conditions within their report. So it doesn't include tree cover, it doesn't include the clouds, it doesn't include the wind. And that's important because when we are communicating with the wildland firefighters at the beginning of the day, the temperature, we want to make sure that's accurate. And then the weather stations don't take into consideration the fire as a potential source of heat. And so, given the changing atmosphere and the changing due to climate change of wildfires, AFFES wanted to assess their current heat illness plan in order to better prevent heat illness amongst wildland firefighters. And that's where I come in with my fourth year thesis project. So we had a couple of research questions that we wanted to have answered. The first was, does the weather data used by AFFES to predict heat stress events match the environmental temperatures on the ground? And we hypothesized that we predict that the true environmental temperatures on the ground will be different than the weather data used by AFFES to predict heat stress events. The next one is heat illness occurring in wildland firefighters. Oh, is heat illness occurring in wildland firefighters that isn't being detected? And then we hypothesize that stage 1 and stage 2 heat illnesses are occurring in wildland firefighters. And that was, if we go back to the stages of heat illness, we believe heat rash and especially heat cramps are occurring and are a precursor to some of the more serious events. So for the purpose of this study, this was what we used for the data collection. So the study consisted of 34 subjects, 5 were females and 29 were males. It occurred in the summer months, so July 1st to August 31st of this past summer, 2022, and included 2 groups. So the first group was environmental. So they were given this pamphlet as well as some other materials, and they were in charge throughout their day, every hour of their shift as located on the bottom, to record the distance from the flame that they were working at, the intensity class of the flame, the environment as to which they were working in, the sun. So was it fully sunny out? Was it partially cloudy? Was it fully cloudy? Canopy, were they working in full, with no canopy, full sun, or were they fully covered throughout the duration of the shift? And they were in charge of doing that. We were going to use that data and compare it to the weather satellite data that's collected. The other group, the physiological monitoring group, was in charge of including those 5 components as well, but also including the work category and the tasks of which they were completed. So the work category can range anywhere from resting, just sitting, or to very heavy, so very intense activity at a fast maximal pace. And we provided them with tasks that they could do. So task would range anywhere from on base, being alert, ready to be deployed, to, hand tooling or constructing lines. So that was one of the components that we were using in order to compare both the environmental and physiological data. And then there were various equipment that were also provided. So we had environmental data group. They were provided with Kestrel drops, which is a small portable temperature reader that most of them just wore around their belt loop. That measures various aspects of temperature, such as relative humidity, pressure, heat index, and dew point. And the purpose of that, in conjunction with the sheet that they were going to fill out, was to measure the temperature that they were actually experiencing on the ground and comparing it with the satellite data. The next group, the physiological data logging group, were provided with an equivital. So the equivital is the little device and the harness that wore kind of like a bra. So the equivital was put in it and in the harness, and it made skin to skin contact and measured various physiological signs such as skin temperature, heart rate variability, respiration rate, estimated core temperature, and then body position. And we were using that in conjunction with the weather data in order to see if on the ground, as they were working in the conditions, were they experiencing physiological signs of heat stress? So that data right now is still in the process of being analyzed. So I don't have any data to present to you, but we are confident that we can make a couple recommendations. So dynamic workplaces such as AFFES should consider personal monitoring options, even something as simple as a Apple Watch that measures heart rate, because elevated heart rate when working in heat is a sign for a consistent amount of time is a sign that heat illness is starting and that you're at an elevated risk to have more serious events. So personal monitoring options like that are great for dynamic workplaces. And then the early stages of heat illness should be more specifically monitored as part of a workplace prevention plan. So taking into account the first two stages that are precursor events to the more serious and more affecting long-term stages of heat illness is essential. And one of the ways and one of the methods that CROSH has right now that they have adopted is there are various surveys that are available that you can do when a heat illness event is occurring and then after a heat illness event has occurred. And it just allows for more monitoring to take place so we avoid any of the more serious heat illness events such as heat exhaustion and heat stroke. And I just want to take a second before I conclude that this project was put on by a lot of people, and without their support, it wouldn't have happened. So to start, everybody at AFFES and MRF, this project was funded by AFFES, and I had a lot of support throughout my time with them. I had the people listed, Michelle, Chris, Jennifer, and Jason were always there to lend a hand and kind of show me the ropes around the base and get me familiar with the processes, and were always there to answer any questions I had. So I really appreciate everything that they did. Then all the participants that were willing to show up and participate and were very active in asking questions and wanting this project to be a success. Everybody at CROSH, this was my first major research project. I had tons of questions and I talked to everybody and I asked everybody questions and they all helped, especially Toby and Dr. Dorman. So I really appreciate their help. And then the NSERT undergraduate student research, which was also involved in the funding on my part of getting me involved in this research project, which I really include. So everybody within this, I appreciate every single help and their involvement within this. And at this point, that concludes my presentation. So I'll take any questions that anybody has.
Well done, Kira. Great job. There's an opening question here around gender or sex differences with respect to acclimatization and or to like your response to high heat. And do you think that those results or those differences would show up in your results?
I do think there are slight physiological differences amongst the genders. I'm not confident that they would be reflected in this study just due to the limited female participation, which is an exact reflection of the ratio of females working at AFFES. There is not as many females as males, but I do think that should be looked at, and I do think that maybe after this study, maybe that would be a follow-up, just kind of looking at the individual heat differences between genders and having more female participants within it.
Okay, thank you. What did the fire rangers say about the equivitals? Like, did you get any comments on whether or not they were uncomfortable or they didn't like wearing them, or like, is that a viable wearable system?
They said it. They said it took some adjusting. They said, obviously, especially for the men, they weren't used to having anything kind of as they were moving through. But one way we combated that, especially at the beginning before people were deployed, is I encouraged them to wear them around for a couple days, especially if they were just sitting on base, just to kind of get comfortable. And as the project progressed, many of them commented that they didn't even notice that they were wearing them. So I think there's a slight adjustment period, but I do think, especially for the work where people are going to these remote locations in order to combat them, they were a viable option in order to see kind of this physiological data associated.
And one last question. It's an interesting one from Toby, actually. He wants to know, can you apply the same approach to cold stress? Like, I mean, that's a problem right now. Various field workers, not so much the firefighters, because they're mostly indoors or off season right now, but for other industries, could we use the equivital, I think, in that context?
You can definitely use the equivital in that concept. I think the kestrels don't have as much tolerance to cold as they do to heat. So if you were measuring environmental factors and temperatures, you probably would have to have a device that would have and be able to withstand the heat like the kestrel can, or sorry, withstand the cold like the kestrel can withstand the heat. But I think the equivital is a great option to measure the physiological data, because that's not as impactful.
Tricky and interesting question, Toby. Now you've got me thinking too, because workers in the heat, they complain if once they start working with exertion, they get hot and sweaty, like not heat stroke, hot and sweaty. But you know, you'd be monitoring their heart rate, I guess, to see for breaks, maybe, right? I guess if they're going to actually get hypothermia, it would also pick up on that with the temperature.